There was this poster presentation at the National Association of Specialty Pharmacy, and it talked about what happens when you go beyond pure provision or pure dispensing and you wrap around these medication use supports for these oral oncolytics. So we don't just release them into the wild and whatever happens, happens. We actually provide these supports around it that indicated that maybe additional work and additional programs could be fruitful, not only from a patient outcomes and humanistic perspective, but even an outcomes perspective. So tell me about this body of work. Where does it need to go? What are the early indications in this space about the cost benefit and the results of adding these medically integrated services to the act of dispensing?
Yeah, there's plenty of opportunity to talk about this topic, and the poster that you mentioned is one example of many that have been published, whether it's papers or posters on the medically integrated dispensing service and that the benefits of having that prescription at the site of care and that continuity of care. We've had several that have been published at the ANCODA meetings, some that were published in the Journal of Pharmacy Practice, again talking more specifically about the cost avoidance that can occur by having a practice better manage their oral oncolytics for their patients, and also the waste that's associated. So tracking of waste, and what I mean by that is when a mail order pharmacy automatically mails a prescription, an oral oncolytic that could be on an average from $10,000 to $15,000 per month, and that prescription has already been stopped by the provider. And we all have probably situations where a patient or a caregiver will bring in a bag of these medications and say, you know, I don't know what to do with these. They keep sending them to me, even though I call them and tell them to stop. And so we track that, and that's been published in several posters and publications talking about how it's just building cost into the system.
And into our rivers and streams. And,
yes.
You know, now you go onto Twitter during Drug Take Back Day, and you'll see 147 unopened boxes of inhalers and whatever else, right? Because the good news is we've realized as a system and appreciate now adherence. The bad news is we associate automated filling with adherence, right? And so there is a cost effectiveness aspect to that, but also on the outcome side, right?
Sure.
So the National Community Oncology Dispensing Association, NCODA, so you're deeply involved with that, obviously.
Yep.
What is it you do for patients, providers, plans, policy?
Yeah, so quite simply, it's providing quality standards, and there's 4 specific quality standards. They fall under 4 different domains that help really set the framework or the benchmark of what a medically integrated dispensing service looks like.
So it's an association of sort of advanced practice, pharmacy, in these practices, if you will.
Yes.
And you're setting sort of the learning collaborative and the standards around this particular space.
Exactly, yeah.
Okay, give me an example of a standard.
So there's 4 domains, as I mentioned. One's foundational, the second is patient-centered, third is positive quality intervention that Krolos is intimately involved in, and then health information technology. And I'll just briefly say the benefit of operationalizing these quality standards is it provides the practice not only a heightened level of care for their patient, which we all want, but it also gives the right to the practice to have that discussion of quality and value with payers and other stakeholders to say we deserve that shared risk of keeping that prescription here within the confines of our 4 walls because we are doing what we know we can do best for the patient, and it's that continuity of care.
So this feels like the HOV lane to me. Here's the regular highway, but we're the HOV lane.
Yeah.
We're economically and environmentally sound, and we have emission standards, and so on and so forth. Fair enough?
Yeah.
And to speak to some of these things that Mike brings out, so in CODA, there are several initiatives that help patients, help pharmacists, help providers. So some of these include the oral chemo education sheets. So HOPA, this was an CODA initiative where HOPA partners with them, ONS, ACCC.
HOPA.
HOPA is the Hematology Oncology Pharmacy Association.
Okay.
ONS is the Oncology Nursing Society.
Okay.
So several of these large recognized organizations, they partner up to these chemo education sheets are standard education for patients. So what's behind it is to standardize the education that we give to patients across the country.
So would this feel like the viz sheets for immunizations?
Very similar,
okay.
very similar, and it's tailored to each drug. And the fact that you have all these national organizations, you have several eyes that look at these educational documents. These are constantly being reviewed and updated based on new indications because these oral oncolytics are often updated. In addition to that, HOPE also does the PQIs, which are the positive quality interventions. So these are tailored to providers and pharmacists, you know, about a specific drug or a specific side effect. How do we manage chemotherapy-induced nausea vomiting? How do we manage diarrhea? Encoda also provides a lot of, there's a new intervention called the TSKs, the treatment support kits. So sometimes some oral oncolytics may need specific supportive cares. You know, there are certain oral oncology drugs that may require anti-diarrheal prophylaxis or may require certain creams and lotions, such as with capecitabine. And this TSK initiative is to provide clinics with these kits that you can provide to patients at no charge. And then these patients will have these supportive care medications, again, to minimize cost, and then for the patients to have these supportive care items at home. So there's tons of exciting things coming out of Encoda, really tailored to everybody involved, the patient, the provider, the pharmacist. So it's been very exciting working with Encoda.
What's next on the table for Encoda? Most important things the next 2 years?
So publication is one of the initiatives that we're going to be starting, and pulling through the treatment support kit. So we've conducted a pilot study at 24 practices, 240 kits, 10 at each of the practices, and we're getting feedback from the patients and also from the practices to make sure that we're hitting the mark that we want. And it's always centered on two guiding values that Encoda maintains, and it's patient-centered and being collaborative. And those are the two things that define Encoda.
Do you also interact with emerging or make policy suggestions around patient assistance programs?
We do. We have a policy committee that's starting, so you would ask what's new for Encoda.
So when I say you have a magic elder wand, you say, well, here's what our policy committee says.
Yes, so the policy committee is one of about 4 other committees that we're starting up fourth quarter 2018, but really getting their legs in 2019.
So with respect to these patient assistance programs, the PAN Foundation, PAN meaning what? Corollas? Patient Access Network. So for the group, so Patient Access Network, Good Day, others. At the association level or the practice level, what does that interaction look like? These are organizations, are they coordinated, not coordinated? Where are these heading? Is there a learning collaborative around these entities?
So speaking to the PAN Foundation itself, one thing I really like about the PAN Foundation is that, so financial coordinators or anyone who kind of goes on their website and looks, they're able to find financial assistance for patients. And one thing that's really good about the PAN Foundation is that if funds are closed, it will actually direct you to other sources that could be available for patients, such as the Lymphoma Leukemia Society and several other organizations that may provide funding. So the PAN Foundation has been really a good resource, and it's often one of the first resources utilized by our financial coordinators, simply because of its ability to direct if it doesn't have options there.
Really, it sounds to me almost like a state SHIP office in some ways. Hey, I've got patients that come in with needs, they don't know what they're eligible for, and I'm helping in whatever way I can help based on that patient circumstance. Good Days, similar circumstance?
Yes, I think all of these are great examples, and particularly PANF, or the Patient Assistance Network Foundation, is part of the Executive Advisory Board of Encoda. Okay. We've got a very good working relationship with PANF. We consider them, good friends. They're patient-centered like we are, and they've been a very good collaborative partner for Encoda and our practices to help us help our patients.